I want to talk specifically about data around race and ethnicity. It's really important to make sure that equity is built into the vaccination program and that you can see what's going on. So I directed the team to do more and to move faster. We are doing 3 things. First, on Monday, Health Commissioner Dr. Norm Oliver wrote to every clinician in Virginia and told them, collect this information, it matters for transparency. Second, we updated all of the relevant websites and customer-facing applications with these words. Please list your race, ethnicity during vaccine registration and at the time the vaccine is given. We ask because we want to ensure that our process for data collection and vaccine distribution is fair, equitable, and transparent to all Virginians. And third, I'm backing legislation from Delegate Lamont Bagby and Siobhan Donovan moving through the General Assembly that will make it a requirement to collect this information. It's the right thing to do, and it's a critical tool to provide you the transparency that you expect. Now, I've heard from a lot of people asking me the same questions. Where can I get a shot, and how do I sign up? How do I sign up my elderly parents? These are questions we expected to address in February, but like every state, we expanded eligibility much more quickly than we originally planned. That has led to confusion about where to sign up and when. That confusion is justified because the answer has not been clear, but we're going to have this fixed very soon. Right now, the solution is to go to your local health district's website or to call them. They've all been directed to create a vaccine registration system so they can take your information and organize appointments. But that's fragmented. It's fine if you can get through, but not nearly enough if you can't. So I've directed the Virginia Department of Health to stand up a single statewide system with a phone number and a website where every Virginian can go and have their information go to the right place. That is not ready today, but I expect it to be ready soon. And I've told the health department that this is a priority. I know this has been a source of great frustration for a lot of Virginians. I hear you, and we're getting this fixed. In addition, we expect to dramatically increase the size of our call center, adding more people to answer the phones. This isn't in place yet, but it also will be soon. I take this seriously because I know that people just want answers. Even if the answer is that they can't get an appointment for a month or 2, it's important that everyone knows how to find out where to go and how to sign up. Finally, I want to update you on a couple of other issues. As you know, we have a whole series of safety policies in place to protect people during the pandemic. Restaurant capacity is limited, bars are closed, social gatherings are limited, and more. We all know what they are. No one wants these rules around forever, so they are set to expire this week. But we need to keep them in place a while longer. So I will issue an executive order today extending the current policies through the end of February. We are ramping up vaccinations. This is no time to let down our guard. I also want you to know that the Department of Labor has made our temporary COVID workplace safety standards permanent. This includes standards around PPE, sanitation, record keeping, and plans and training around infectious disease preparedness in workplaces. These standards become permanent today. In closing, I want to say what is on everyone's mind. Vaccines are the light at the end of this long and dark tunnel, and they are a great reason for hope and optimism. I also want to acknowledge that everyone is out of patience. and I understand that. That's why I wanted to make sure that you understand the actions that we're taking to get more shots in more arms every day. It will take time to reach everyone, but we are reaching more people every day, and the pace is increasing. So I ask you to please do the right thing. Let the most vulnerable people get their shots first. Keep washing your hands, keep wearing your mask, and keep distancing from other people. It's the right thing to do to take care of each other. I also want to say a word to our team here at the state capitol and everyone working throughout Virginia in healthcare. You are doing heroic work. I want to thank you for stepping up in a big way. I know that you're exhausted and you're out of juice right when we're asking you to push even harder. I also know what you're capable of, and I have seen you rise to meet the job that needs to be done. We need you to do it once more, and I have faith in you, so thank you.